Hello, welcome to the office. I'm Darcy Collins, licensed clinical social worker for the past 14 years. Today, I want to talk about what is therapy, and I hope to answer three important questions. What is therapy? Do I need it? And what if I'm doing it and it's not helping me? So to start out, what is therapy? What the heck? People tell me, go to therapy. I hear, go to therapy. So what even is it? Well, it's the process of sitting down with a licensed therapist, counselor, either one-on-one or in a group setting with other people, usually led by a therapist, a licensed counselor. And commonly, you're going to bring problems that you've been experiencing. Often, they'll be talking about symptoms. Symptoms you've been experiencing, especially if you're using an insurance benefit. Insurance wants to establish something called medical necessity to be able to use your benefit for therapy. So there'd have to be some identified symptoms that match into this big giant book called the DSM, Diagnostic and Statistic Manual. And that connects with a diagnosis, meets the criteria for a diagnosis. If you just happen to be paying out of pocket for the therapy service, that's probably not going to have to be such a concern. So you're showing up, you're meeting with this person, perhaps you're going to their office, perhaps you're connecting with them online through video, or again, going and sitting in the group with the therapist, with other people as well. The first time, you can expect a lot of questions, getting to know a little bit about many different areas of your life. What's going on now? What happened? What was your early life like? Who are you connected with now? What's your vocation? Education experience, checking in on general health concerns. This is to get to know you, better understand what's happening, hear your story, get a sense of what's happening. For the therapist, getting a sense that therapy could even be useful for you in the first place. And identifying an initial plan. What can we do about the goals that you have? And certainly, the more specific the goal you have coming in, the more effective that process can be. Well, when it comes down to it, you'll sit down with this person or you'll sit down in the group and you bring forward your problems and they're going to be looked at in a systematic way. And now that depends because my joke is there's about 10 billion different ways to do therapy. And I'll say, well, this is just simply one of them. But there's a whole alphabet soup out there of different ways to do therapy, and they're all going to offer something a little bit different. They're all going to take a bit of a different stance, focus in different areas. There's something out there that can generally meet most people's needs. Now, for the most part, I think therapy really is going to boil down to two things, two change mechanisms. One, helping to change and shift perspective. The way we're looking at something, the way we're thinking about something, how we might feel toward it, how we act with it, toward it, whenever it's around. And there's a lot of different ways to make that happen, but the one big bucket there is going to be perspective shifting and changing. And the other big bucket is going to be something called memory reconsolidation. Basically, the process that our brain has for storing emotion-based memories and how this can change, how those memories can change. They're doing it on a day-to-day basis on their own. There are certain therapies that take a direct approach toward this memory reconsolidation. And then there's also just the good fortune of it happening from sitting with this person who's offering very different, unexpected responses. So basically, things fall into those two buckets: perspective shifting, memory reconsolidation. Therapy, whether sitting down one-to-one or sitting down in a group, if the change is happening, one or both of those things is taking place. Question number 2. Do I even need to go to therapy? I get it. Maybe someone in your life is saying, hey, you know what? I think you need to go talk to a therapist. You need to go talk to someone. Yeah, perhaps you saw it somewhere. Perhaps you read it somewhere and you've heard a lot about this therapy thing. Well, everybody's doing therapy. Everyone's telling me to go to therapy. What the heck? Do I even need that? Well, it is a big question. And some will say, yes, everybody needs therapy. Everybody should go to therapy. For me, I don't think therapy is for everyone. I don't think therapy is the answer for everyone. There's so many different ways to make meaningful change in one's life. Therapy certainly is an option, and it can be a very useful option. For me, it's not the only option, and it's not something that everybody needs or has to have. Though, if you've been feeling particularly depressed, down, sad for a really long time, weeks, months, longer, and it's difficult to get your usual life activities going, things don't seem so enjoyable, energy's consistently down, difficult to concentrate, therapy might be an option to consider. If you've been feeling particularly anxious, day in, day out, days, weeks, months, worry, riddled with worry, it just doesn't seem to go anywhere. Nothing happens with it. Therapy might be useful for you. Other very specific cases, you have very specific fears. These get called phobias. And it's really impacting your life. It's making something, some aspect or aspects of your life really difficult to do. Therapy can definitely be an option. You've had a really significant loss in your life and you're having difficulty handling it. The supports you might have already in place just don't seem to be cutting it. Therapy could be an option. Therapy could be useful for you. Question number 3. What if I'm already in therapy and it's just not working for me? Or I've done therapy before. It didn't work for me. It didn't do anything. What do I do with that? Well, if therapy's not working, there might be a couple different reasons for that. One, you just didn't find the therapist match that really fit for you. This is probably the most important factor. If there's something that just turns you off about the therapist or you can't stand it, they could be amazing. They could have so much knowledge and so much experience. If there's just that something there that's just doesn't seem right, something that turns off, you're not going to connect. You're not going to listen to them. It's not going to go anywhere. Now, this isn't to say if you have disagreements or the therapist says something you don't like while you're meeting with them, that's something to work directly with the therapist on. But if there's something there and it just, you're giving it a shot, 2 to 3 times is pretty reasonable to see if it just doesn't fit or if it's just, something else is going on here that's a lot like something else that happened to me before, which is actually a great opportunity if that's going on. You pick up on it or the therapist is picking up on it. That's an awesome opportunity to work that out and change that. But after that time, if it's just not fitting, it just doesn't feel right, seek out someone else. Sometimes the shoe analogy fits. Sometimes you have to try on a few pair of shoes to find the right fit. But that's important. If the right fit's not there, therapy, no matter what it is just simply not going to work. I refer back to question 1. Are you somehow stuck in the same perspectives? Haven't done anything that would get that memory reconsolidation going. Whatever's happening in therapy, if either one of those isn't going on, then yeah, it's not going to work. It's not going to feel like it's doing anything for you. So you can definitely check into that. My perspectives shifted at all? Am I hanging on to them? Are they like a comfortable blanket for me? And the memory reconsolidation piece, now that would be one the therapist would guide to help make that happen. And the really tough one, but important to mention. Great, you're going to therapy. You show up at the office for the appointment, for the scheduled time. You log on, you get on your computer, you get on your phone at the scheduled time. Fantastic. Step 1, show up. And if that's all you're doing with it, just showing up, just walking in the door, just logging on, and nothing else is done about whatever the issues or the problems may be outside of that time. There's no work, no efforts towards shifts or changes outside of that scheduled time. Yeah, therapy is not going to work for you. Could be a reason why it's not working or hasn't worked. So, if you're there, if you've been there, you have a very significant role in the process. Hopefully, this offered some information, cleared up the picture a bit about what therapy is. Is it for me? And if I've done it and it's not working, what's going on there? Please feel free to check out the other videos on the channel. You'll find additional resources, guidance, things to do, tools, we might call them. And if you're in New York State, and if you've had interest in working with me directly, you'll find me at www.darcycollinstherapy.com. Thank you for watching, and remember, you've just been seen today.